everybody to our smallholder keeper webinar on avian influenza. This is intended to give you practical measures on biosecurity that you can take on your premises. My name is Gonzalo Sanchez. I'm the Chief of Staff for the UK CBO. I'm just going to run a little bit quick over the agenda. So we will have different colleagues from policy and field epidemiology talking to you today. We will have an update of the avian influenza latest situation. And the key thing is today to come away with messages of essential biosecurity actions that you must take. And there will be further contact details and further information provided at the end of the presentation. So without any more hesitation, I'm going to hand over to my colleague, Lara, from our exotic disease policy team. Thank you.
So hello everyone, and thank you for attending today. My name's Dr. Lara Harrop and I'm one of the policy team leads in the Defra Exotic Disease Control team. I'm going to kick off today's webinar by giving an overview of what the latest situation is regarding cases of avian influenza, commonly known as bird flu, and what preventative control measures have been put in place nationally to help stop the spread of bird flu. I'll follow this up with a short 101 on what bird flu is, how it is spread and why your birds could be at risk, before passing over to my veterinary and epidemiology colleagues who will discuss how good biosecurity can be practically implemented on the ground to help you protect your birds and what you need to do if you suspect bird flu in your birds. So the UK is currently experiencing its largest ever outbreak of avian influenza. Since the first case of avian influenza in this outbreak was detected in England on the 26th of October 2021, up to when this webinar was recorded on the 6th of January 2022, 77 cases of avian influenza in poultry or other captive birds have been detected. This is with 64 confirmed cases in England, 5 in Scotland, 3 in Wales and 5 in Northern Ireland, so affecting all the administrations of the UK. There have also been multiple findings of avian influenza in wild birds from sites across the UK. As this is a rapidly developing situation, for the latest updates on confirmed cases and guidance, please see gov.uk/bird flu. The location of disease control zones surrounding infected premises, where additional control measures applied to bird keepers, can also be viewed through using the APHA's interactive disease map, and this is available via gov.uk/bird flu. There'll also be links to all of these resources at the end of this webinar. So to put this winter's outbreak in scale, in scale of other previous outbreaks, during the outbreak over winter in 2020-2021, 26 cases of avian influenza were confirmed, and over winter in 2016-2017, just 13 cases of avian influenza were confirmed, despite these outbreaks previously being considered large outbreaks with substantial impacts on bird keepers. So what's been done to help prevent the spread of avian influenza nationally? Following the first case of avian influenza and escalating numbers of findings of avian influenza in wild birds, an avian influenza prevention zone came into force across Great Britain on the 3rd of November 2021 and in Northern Ireland on the 17th of November 2021. This was supplemented by additional housing measures coming into force across the UK from the 29th of November. So what does this mean on the ground? This means that it's a legal requirement to keep all birds indoors and follow strict biosecurity measures in order to limit the spread of and eradicate the disease from the UK's poultry and other captive birds. Next slide, please. So what is bird flu? It's a highly contagious viral disease caused by the avian influenza virus. It primarily affects birds, but it can also affect humans and other mammals. And before I move on to how avian influenza spreads and what with my colleagues what you can do to help protect your birds, I'll just run through a few aspects of the terminology which helps describe avian influenza. So viruses consist of proteins, and avian influenza viruses are classified according to the H and N proteins. There are 16 different H proteins and 9 different N proteins in influenzas that affect birds, and any combination of these is possible. However, from an animal health perspective, it's the H5 and H7s that are considered the most important for animal health. All of the avian influenza cases in the UK this winter have been of the European H5N1 strain of avian influenza. This is in contrast to last winter when we had multiple strains of avian influenza circulating. This European H5N1 strain is highly contagious for birds, but the UK Health Security Agency advised the risk to the general public's health is very low. And the Food Standards Agency advised that there is a very low food safety risk to UK consumers, and properly cooked poultry and poultry products, including eggs, are safe to eat. This is important to note as there has been historic cases globally of an Asian strain of H5N1 that did have increased public health concerns. However, this European strain of H5N1 that's currently found both in the UK and in continental Europe is considered a very low risk to the general public's health. However, a precautionary approach is always taken by regional public health protection teams for people who have come into either very close contact or prolonged contact with infected birds. The one other principal characterisation for avian influenza is their ability to cause severe disease, with strains of avian influenza classified as either highly pathogenic avian influenza, which can cause severe disease and is often fatal in susceptible birds, or they can be classified as a low pathogenic avian influenza, which generally cause mild disease or no disease at all, with typical signs being mild to moderate respiratory symptoms, drops in egg production, or secondary infection, which emphasises the importance of record keeping, which my colleagues will touch on later in this webinar, in order to support the close monitoring of the health of your birds for any changes in how they're doing or their production rates. However, clinical signs of both highly pathogenic avian influenza and low pathogenic avian influenza can vary between species of birds. And while low pathogenic avian influenza can have a more limited impact on the health of the birds, in most cases than highly pathogenic avian influenza, low pathogenic avian influenza can turn into highly pathogenic avian influenza once it gets into a flock and starts spreading, hence why it still is of significant concern from an animal health and human public health protection status. So our key message here is if you have any concerns regarding the health of your birds, is to contact your vet. If you suspect any type of avian influenza in poultry or other captive birds, you or your vet must report it immediately to the Animal Health Agency. So next slide, please. But how does bird flu spread? So a bird flu outbreak can occur at any time point in the year. However, the UK faces a seasonal increase in the risk of a bird flu outbreak occurring associated with the winter migration patterns of wild birds, and these are often migratory waterfowl. But the risk is not just where migratory wild birds are. The infected migratory wild birds, when they arrive in the UK, can go on to infect local or sedentary wild bird species, poultry or other captive birds, which can then result in local transmission. The virus can be transmitted directly between birds, or quite importantly, indirectly by birds coming into contact with environmental contamination, including feces and feathers from infected birds. Hence, it's really important to think it's not just where the wild birds or other birds have been that the risk is faced to your birds, it's where they have been in the past or where their contamination may have been transferred to. But what can you do to protect your birds? High standards of biosecurity should be maintained as good practice for the health of your birds. And good biosecurity is an essential defence against diseases such as avian influenza and is key to limiting the spread of avian influenza in outbreak. But this must be coupled with close vigilance and keeping a close watch on your birds for any signs of disease and seeking prompt advice from your vet if you have any concerns. I'm now going to pass over to epidemiological colleagues who are going to go through some of the details in practice, what biosecurity means on the ground and what you can do to protect your birds.
Thank you, Lara. Hello, everyone, and welcome. My name is Richard Heppel. I'm a veterinary epidemiologist, but I'm also a hobby flock keeper myself. So I do have quite a considerable appreciation of some of the practical issues that can be faced when trying to house birds and implement effective biosecurity away from a commercial setting. I've also done a fair bit of work with a number of hobby sector groups throughout the 2020-21 and the current outbreak, and they can provide an awful lot of practical information. Many of the links you can find on Facebook to those various groups. So looking at, in general, 2020-21 and the current outbreak, certainly in 2020-21, all the outbreaks that we detected were attributed to either direct or indirect contact with wild birds. There was no evidence of longer distance spread, so no big jumps of infection from one area to another, either in the previous outbreak or in the current outbreak to date, other than when the premises are located very closely together and are part of the same business, which indicates that the biosecurity within the business may not be working as effectively as it should be. In general, we have to consider the wider risk from wild birds and consider that the whole of Great Britain really is at a heightened level of risk of infection from wild birds. Towards the end of the presentation, there is a slide with further information, and I would point people to the International Disease Monitoring Outbreak Assessments, where there are maps showing regularly updated, showing both the domestic cases and also the cases in wild birds, and it's very obvious from that map that the distribution of detected wild bird cases is all across Great Britain. So essentially, we're all at risk, and we have to do everything that we can possibly to protect our birds. Generally, we find that a lot of the components for biosecurity are ostensibly present, but they're just not done very well. We'll look at some of the potential issues further on in the presentation, but examples of this were that facilities such as buildings, enclosures are poorly maintained, and we may have ineffective biosecurity in terms of cleaning and disinfecting vehicles, equipment, etc. Visitor book records may be deficient, which causes problems with tracings. And essentially, poor biosecurity can lead to virus being walked into the bird enclosures. There's also a misconception that we see on some sections of social media that this is purely a disease of the commercial sector, and that is clearly not the case. If we look at the cases so far in this outbreak, approximately a third of those have been in smallholder or hobby type flocks or wildlife rescue centres. So it is a problem that can affect all of us. It's a particularly virulent virus this season. Some of the reports that we've seen in terms of birds dying, they start off with reporting one death, the next day 30, then 450, and then we have comments such as too many to count. So it is a very nasty virus that does hit the birds hard. As Lara mentioned in the clinical signs summary, certain species may be less affected, but with this particular virus, even within some of the waterfowl species such as ducks, we are seeing clinical disease, including deaths, both in domestic captive species as well as in the wild birds. And some of the reports we've seen from hobby keepers, that we've had people coming down in the morning with nothing wrong the day before, and they found 7 out of 50 birds just dead with apparently no preceding clinical signs. So the take-home message is it's very nasty virus. There's also a misconception in some sectors that pedigree birds, such as birds in the show sector, may be less susceptible. That is clearly not the case, and we've seen disease in all types of chickens, not just the ex-commercial rescue birds. So everybody needs to play their part to protect the birds. Biosecurity in general is not rocket science. We all need to do the basics and do them well. Essentially, we need to assume that the environment around our bird enclosures is heavily contaminated, and we need to take all measures to stop walking that contamination in. A very good analogy is consider that the area around your bird accommodation is covered in emulsion paint, and we have to take all possible measures to stop walking that actually into the bird enclosures. Only very small amounts of the virus are needed to actually infect birds, and then once birds are infected, the virus is amplified and further spread on and can have devastating effects. It's also very important to remember that the virus can survive for a prolonged period of time in the environment or contaminated surfaces. It's too early in this outbreak for the H5N1 to have particularly up-to-date data, but the virus is closely related to the H5N8 that we saw in the previous season, and the information from that is that it can survive at least 21 days at 4 degrees centigrade. So in cool, damp conditions, virus can be survival can be prolonged and provide an ongoing risk to our birds from being walked in from the contaminated environment. It's also important to remember that biosecurity is done best when we don't have disease, and we all need to get into the habit of practicing good biosecurity. By the time disease is present, it's too late. So it's not just for exotic disease outbreaks. There are a wide range of benefits in terms of endemic disease. A lot of those also can come from wild birds. And effective biosecurity can reduce the risk of that and keep our birds healthy out with an outbreak. Very briefly touch on licensing here. Many people may think this is more applicable to the commercial sector, but we have to understand that there are particular restrictions around outbreaks in protection zones and surveillance zones, where a lot of movements are only permissible under the authority of a license. License effectively permits you to do something that otherwise would be illegal, and biosecurity, effective biosecurity, is key to the licensing conditions. It's all based around risk assessment. It depends on people being able to demonstrate effective biosecurity to give the reassurance that allowing a move is not going to provide a risk of disease transmission. If you are, I would certainly recommend people to look at the interactive map on the gov.uk website. You can put in your postcode and see if you're in one of the particular zones, a PZ, a protection zone or surveillance zone around a confirmed case. And also bear in mind that the whole of Great Britain is still under an avian influenza prevention zone. So restrictions and certain regulations do apply across the whole of Great Britain, not just in the areas around the confirmed outbreak. Within there, if you do happen to be within a protection zone or surveillance zone, you can look at the relevant declaration on the gov.uk site, and that will give the more specific requirements that need to be observed if you are in one of those zones, and certainly the cases where licensing may be necessary. The take-home message really here is that good biosecurity requires real effort. It needs to become a mindset that's ingrained, that we do it as a habit, and it becomes second nature, so that we're not having to rely on it purely when exotic disease is present in the country. All of us have a part to play, and it's particularly important for people not to feel overwhelmed if they feel that they can't achieve perfect biosecurity. Every little step that we can take can reduce the risk of disease coming into contact with our birds, and every last measure that we can take, they all provide an additive effect overall to protect our birds. It's also important to remember that the housing order is in place to protect our birds. It can be tough for birds if they're not used to being confined for long periods, and certainly there can be issues with behavioural problems. So taking measures to provide additional enrichment to try and reduce those is important. And again, there's information and advice and guidance present both on the gov.uk site and provided by some of the hobby groups, the hobby sectors, for example, on Facebook, where there's some real practical advice to help reduce those issues. Moving on to the key issues for biosecurity. Bedding and enrichment material can be an issue. Bedding management and how we treat enrichment material. We have had examples in the past where people have wanted to provide enrichment material such as branches for additional perching, turf for grazing, but we have to ensure that we are considering the risks of introducing these. We certainly don't want to introduce something that's potentially contaminated, that's been sitting in the garden, and then we may be doing all the biosecurity correctly in terms of boot dipping, protective clothing, etc. But then we can bypass all of that by taking in contaminated material. In terms of management, again, for birds being housed for prolonged periods of time, consideration can be given to use of ground sanitizers to help with bedding management. They can help reduce moisture in the bedding. They can reduce the pH, help with reducing ammonia levels and smell. And there are a number of these products which are available, and at least one of them actually also includes an approved disinfectant to help with keeping the ground within the enclosures as clean as possible. Building maintenance and design is very important as well. We've seen in previous cases plenty of issues where we maybe had leaking roofs. We've had gaps in the building structure allowing wild birds or rodents to enter. Blocked guttering can lead to water from the roof that may be contaminated by wild bird feces being washed into the housing. Similarly with flooding, so in heavy rain, if we've got large amounts of water going into the run, that can effectively wash contamination into the bird's accommodation. We also need to be aware of keeping, as well as keeping gutters clear, making sure there's no moss on the roof, or that the bird accommodation is surrounded by overgrown vegetation, overhanging trees, etc., which can all be an attractant to wild birds and increase the risk. In terms of accommodation, ideally we would want to have a solid roof, or barring that, if we're using an enclosure, something like a tarpaulin over the top to prevent bird feces falling in from above. And we have had examples of that where only netted enclosures have been used, and birds have still been infected by material coming in through the netting. And in conjunction with that, we need to ensure that the rest of the enclosure is netted on the side with a fine enough mesh netting to prevent access of smaller wild birds. We also need to consider location. Most of Great Britain will be near either the coast or some wetlands, watercourses, ponds, rivers, lakes, etc., which may be frequented by wild birds. We have to be conscious of other activities that we may be undertaking, for example, walking the dog, that we don't want to then come back with contaminated footwear that we use to go into the birds, so bear that in mind. A key point to bear in mind that when we talk about C&D, that's cleansing and disinfection, and there's no point disinfecting something that is already dirty. So it's very important that we clean anything, so footwear, equipment, etc., before we apply the disinfectant. Most disinfectants are rapidly inactivated in the presence of organic matter. So if you've got a lot of soil or other organic matter within your boot treads, that is, it can reduce the efficiency of disinfection. Ideally for disinfecting boots, etc., before entering a bird enclosure, we'd recommend ideally having a hard standing around the area immediately around your bird accommodation. A hard standing such as a slabbed area or concrete can be kept clean and disinfected, and then reduce the contamination before we disinfect our footwear before we go into the bird enclosures. Personally, I use a pre-wash, so for my boots, so I wash them, use a stiff bristled brush to remove any gross material. It's very useful to use something like an equine hoof pick or a tent peg to particularly get ingrained material out of boot treads, etc. Make sure that the footwear is thoroughly clean before disinfecting it. In terms of disinfection, we'd recommend having a foot dip, ideally in a robust container that can be covered. It's important to remember that we need to use an approved disinfectant, and it needs to be used at the correct dilution rate and regularly replenished. as mentioned before, contamination by organic matter will reduce the effectiveness. So using the correct dilution and contact time and replenishing in line with the manufacturer's instructions, or if it becomes heavily contaminated, is very important to bear in mind. Use of a covered foot dip is important, particularly if it's outdoors, because rainwater can obviously dilute the disinfectant and make it less efficient, as well as at this time of year, organic matter such as leaves being blown into it and causing an issue. We also need to bear in mind health and safety considerations. So if you have children, small children or pets around, it's important to keep the disinfectant clear so they don't have covered, sorry, so they don't have access to it. As an alternative, we can also consider use of dedicated footwear that is kept within the bird accommodation and only used when going in. It's very important to have a clear demarcation between what we consider is the potentially dirty area and the clean area, which is where the birds are kept, and make sure that we're not taking contamination across that line. As part of APHA's work, there have been liaisons with the Surrey poultry vet, who's produced a number of very useful and practical videos to help with hobby keepers, showing them some simple measures they can take in terms of effective biosecurity, and those can be found in the links to the APHA Facebook pages that are found at the end of this presentation. Lara touched on record keeping. That's obviously record keeping. There are certain statutory things that we have to record all year round, not just within an outbreak. So for example, uses of medicines, and there are specific format of the things we need to record for that. But it's also a requirement within the AI prevention zone, and then more specifically within protection surveillance zones, that we do keep records of visitors, vehicles that may come into contact with the bird area, movements of birds, eggs, etc. And these can all help us in terms of tracing disease in the event of an outbreak. Those sort of records don't have to be anything particularly fancy. It's perfectly fine to keep those in a diary or on a calendar, as long as they can be presented on request. And it's also important to bear in mind that if we have accurate dates like that, it does help the epidemiology team when we are tracing the source or spread of disease. And in some cases, it can help us risk assess certain contacts out of the frame in terms of our concern about them, if we do have evidence of confirmed dates. So it's much better to have an evidence of date that somebody visited last Monday and it's written down, rather than somebody visited within the last 2 weeks but we can't remember when. That brings in considerable uncertainty. Moving on, in terms of staff and protective equipment discipline, it's important to remember that we're using our PPE, our personal protective equipment, to protect our birds, not just our clothes. As mentioned, ideally we'd have dedicated clothing and footwear that we only use for attending the birds, and we store them undercover safely out of the way of wild birds or potential contamination when not in use. So ideally we're not going to want to use these things for other activities such as gardening or tending to other livestock. We keep these clothes purely for use when we are entering our bird accommodation. It's also very important to remember that children, small children and pets have no concept of biosecurity, so we really need to limit their contact with the birds during the high risk periods. In terms of vehicles and visitors, we really want to absolutely minimize contact with birds or bird areas to reduce the risk of contamination being brought in from elsewhere. Wild birds and rodents are very important to consider. So in terms of rodent control, rodents themselves, we wouldn't be particularly concerned about them being actually infected with the virus, but they can act as a mechanical transport medium, and they can actually bring virus into the bird areas on their feet or on their fur and bypass our biosecurity. So it's important to try and reduce the risk of contact with rodents, so removing food overnight when not in use, Personally, I use treadle feeders, which are very effective, that the birds can use them, but rodents can't get in, and it keeps the food safe and protected. Ideally, we'd have a solid floor to the bird accommodation, so rodents can't tunnel in from underneath. The alternative can be to embed a heavy gauge, small gauge wire, small mesh wire under the flooring, under the bedding that we have, to prevent them tunneling in as well. In terms of controlling them, if you do have a problem, we'd certainly recommend consideration to use of a professional pest control service who can effectively and safely take care of rodent problems. We need to be very aware if using rodenticides to avoid secondary poisoning, both of pets and birds. In terms of wild birds, we've already mentioned netting to prevent the birds coming in, and a solid roof. It's important to remember that there are a lot of bridging species. So as Lara mentioned, the disease is predominantly brought into the country with migratory waterfowl, but once present, it can get into bridging species. So species such as gulls, corvid species, birds of prey, they can then all act as a resident source of infection to localized birds. In terms of the netting, it needs to be a suitable gauge to stop all wild birds entering. There has been evidence from studies in France where they found that birds as small as sparrows can be infected with avian influenza and potentially transmitted to our own birds. We also need to be aware of discouraging attracting wild birds into areas around the accommodation. So don't feed wild birds in the garden or areas near to where the birds are kept. Give consideration to use of bird scaring devices where appropriate. In terms of contingency planning, really that's a case of looking ahead. We've had a number of housing orders over recent years, so it's something we need to prepare for out with the disease outbreak, so we're ready when it does come into play, and we're not panicking at the last moment trying to find out how we can house our birds and effectively keep them safe. Again, I'd refer back to some of the hobby flock Facebook groups that I've worked with, where you can get to some very good and in some cases very innovative examples of how we can house our birds and keep them suitably entertained. In terms of separate premises in close proximity, such as allotments where a number of keepers may have birds, we need to really be working together to make sure that everyone is taking the same degree of measures. So, for example, netting ponds that are present, keeping our birds effectively confined, so everyone's working together to protect each other. And just finally, before I close, it's worthy to mention birds of prey. We have, certainly in the 2020-21 outbreak, we had at least 2 outbreaks involving captive birds of prey, and the source of disease in both those cases was frozen wild shot game. So birds had been shot within the high risk period for wild birds and frozen. There's a misconception that freezing will actually kill the virus, which is by no means the case, and in fact freezing will actually preserve the virus. We have to bear in mind that in our reference laboratory, any virus that is preserved for future research purposes is frozen to keep it active. So we need to be particularly aware and avoid feeding wild shot game if it's being sourced during a potential high risk wild bird risk window. And I think that's me done. Thank you.
Good afternoon, everyone. My name is Christian Chulik, and I'm one of the senior veterinary inspectors based in the southeast of England. I'm going to start by talking what happens when suspicion of disease is reported from the APHA point of view. So owners, private vets, official veterinarians, and laboratory are the most frequent sources of reports. Across small holding flocks to multi-shed and multi-enterprises, the principles of APHA response are the same. As a poultry keeper, once you identify one of the main clinical signs in your birds, or many clinical signs in your birds, we encourage you to call Animal and Plant Health Agency by using the single point of contact number, which is 03203 301. And then you have the option 1 to select, which has been specifically implemented to report suspicion of avian influenza. Therefore, you're not going to be waiting on the phone to be put through an operator. The second case is the private vets reporting the suspicion of avian influenza. In that case, is regarded as a consultation case, which implies that APHA will liaise with your vet to gather information about the history of disease and details of the premises where the disease is suspected. Whoever calls will be put through a customer advised duty vet that will take the details of your premises, details of the clinical situation on your premises, and what made you suspect the avian influenza. If the initial assessment done over the phone concludes that notifiable disease cannot be ruled out, then the vet will put verbal restrictions on the premises. The customer advised duty vet will then call a regional vet within the geographical area where you are located, and then the vet will be deployed within 30 minutes from notification being made. Once arrived on farm, following the biosecurity protocols, there will be formal restrictions placed on the premises, and then the veterinary investigation can commence. The veterinary investigation includes clinical inspection and/or examination of the birds, and possibly sampling whilst adhering to strict biosecurity measures. Also, data will be gathered, including disease history, movements on and off the premises of anything as animals, feed, bedding, and details about number of people attending the birds and the levels of their involvement. After a thorough investigation, there could be two outcomes. Either the disease can be ruled out by the veterinary officer on clinical grounds, or the disease cannot be ruled out and further actions will be taken. For quality assurance purposes, a telephone report will be made from the farm by the investigating officer to one of the veterinary officers in VENDU, Veterinary Exotics and Notifiable Disease Unit in London. And after going through the details of the clinical picture and disease history, a decision will be taken if the disease is suspected and can be negated, in which case the restrictions will be lifted and you will be directed to seek veterinary advice from your private veterinary surgeon, or the disease cannot be ruled out and samples will be taken and sent to the laboratory in Weybridge. The number and nature of the samples will be based on the advice received from VENDU and will depend on the species of birds you have on site, indicator species versus non-indicator species, but other factors could be taken into consideration. The samples will be sent by courier from the farm directly to the APHA laboratory in Weybridge, and after arrival, a PCR test will be done and results will be normally available within 24 hours from the samples being taken. If the results are negative, we will inform you about the outcome and will lift restrictions and the investigation will end. Or, in the event of the results being positive, we will again inform you about the outcome, and further testing will be done by means of virus isolation at 2 days with preliminary results, and further test at 6 days with the final results. Therefore, a definite final result will be available after around 6 days following the on-farm investigation. However, actions will be taken after the preliminary results being available, and once the Chief Veterinary Officer is content, we will then proceed to organize the valuation of your stock no sooner than 24 hours before the culling, and we will cull the remainder of the birds on site. The valuation is done taking into consideration how many birds are dead, ill, or look healthy at the time of the assessment, and compensation is only payable for the birds that look healthy at the time of the valuation. The culling is performed humanely under the supervision of one of the APHA's vets or dealt by a contracted vet, and we want to ensure that the welfare of the birds is not compromised until the very end. So regardless of how fast we would like to deal with the case, the welfare of the birds is paramount. Then the disposal of the dead poultry carcasses and any other poultry products will be dealt with by the APHA. The final step from the APHA delivery point of view is the preliminary cleansing and disinfection performed by one of our technical officers. And this is going to be followed by written reports after the 24 hours have elapsed. You will be designated a case officer, and the follow-up procedures will be discussed with that case officer, and will entail secondary cleansing and disinfection at your expense. Restrictions will only be lifted after the APHA is satisfied with the procedures. So as soon you action the secondary C&D procedures, the better. Next slide, please. Right, so there's some misconceptions and unfounded rumors circulating on social media platforms or in other groups. And we would like to assure you that there is no automatic culling policy for avian influenza outbreaks in the UK. Birds will only be culled on the premises if a veterinary investigation is carried out and avian influenza is confirmed in the flock following the laboratory testing of the samples. Or a veterinary risk assessment indicates that there is a strong likelihood that your premises where the birds are being kept has significant links to an infected premises where the disease has already been confirmed. These links could be via movement of birds, poultry products, people, equipment, or vehicles between those two premises. Therefore, most premises in the 3 kilometers protection zone will just receive a veterinary inspection to provide reassurance that the birds are fit and healthy. However, sampling of waterfowl may be needed, as these birds often do not show signs of infection but could still be carrying the virus and transmitting into your domestic poultry. Further details can be found on Notifiable Avian Disease Control Strategy for Great Britain, which can be found on gov.uk. And that's about all from me. Thank you ever so much for attending the webinar, and further information can be found on the links in the slide. Thank you.